Veronica Markley is on the mend after fighting for her and her baby's life. She left the hospital on April 21st after being in the intensive care unit and on a ventilator.
It was really hard being alone. There was like a day and a night, I just was in despair. Like, I just couldn't believe it had happened to me, and like depression and loneliness and sadness.
Now, at 23 weeks pregnant, she is still taking it very slow. She is much stronger, but she's not even close to her pre-COVID state. Physical therapy, breathing therapies. Each day is a little win, both she and her doctor say.
When she first left the hospital, we sent her home with an oxygen saturation monitor, and we had video calls with her on a daily basis for a couple of weeks to make sure that she was really continuing to move in the right direction.
Doctors learn a little more each day about COVID-19, but right now experts say there are so many unanswered questions pertaining to pregnant women and their babies.
The women that we've seen critically ill have been in their early third trimester, but that's just a very small sample size. I don't want people to be falsely reassured by lack of data. I think that there's real danger in taking too much comfort from not knowing enough.
The first thing, obviously, is maternal deaths. The women who deliver in hospital, whether they do deliver prematurely, whether they deliver by cesarean section. What are the psychosocial consequences for women who either deliver alone or had planned a certain type of birth with the support of a doula or a midwife and then don't have that experience? Will there be long-lasting consequences?
National Institute of Child Health and Human Development Director Dr. Diana Bianchi tells Newsy they're working on getting adequate numbers in the U.S., just starting a study of 1,500 pregnant women with COVID-19 and their babies after they're born to see what consequences infection has on birth defects and a baby's growth pattern. The NIH has also started to collect and analyze medical records from some 21,000 pregnant patients across more than a dozen U.S. hospitals, hoping to find answers to those questions. It's not just for the pregnant women and their babies. One small recent study showed 87% of mothers admitted to the ER showed no COVID-19 symptoms, despite testing positive for the virus. The data, Bianchi says, is crucial for officials to make safety decisions.
Very, very practical questions right now that are circling around, like whether all pregnant women presenting for admission should be tested so that everybody knows what they're dealing with. But so far, the American College of Obstetrics and Gynecology has only encouraged it. They haven't absolutely made it a rule and regulation that every pregnant woman has to be tested at the time of delivery. But I think hopefully ultimately we'll get to the point where everyone is tested.
As for Veronica, she's counting down the days until July when baby number 2 is due and working on healing. As she waits for answers, she has a hopeful but pragmatic message for others in her shoes.
It's not like I came home, so I'm better. It's going to be a slow recovery process, so I really try to say that.
Lindsay Thies, Newsy, Denver.